Hi there, Selena here, and I'm adding a post-production note to the top of this episode because Surgeon General nominee Dr. Cichy Means has resurfaced, and she's very busy gearing up for her confirmation hearing by finally filing her ethics and monetary records detailing her multitude of conflicts of interest. She's promising to divest from Levels Health, TrueMed, Function Health, and other conflicts of interest, including Philip Morris and Altria, aka Marlboro. Yes, the future Surgeon General will benevolently give up her family investments in big tobacco, the number one cause of preventable death. I look forward to being a Making It Awkward mean sibling correspondent and reporting on Casey's probable path to the White House and, of course, the tasteless snacks she brings to the confirmation hearing.
Welcome back to Making It Awkward, a podcast by people who know that the S in SMART goal stands for specific. This is an independent podcast by me, dietitian Jessica Wilson. You can buy my book. It's always been ours wherever books are sold. You can follow me on Instagram at jessicawilson.msrd. To support the podcast, you can rate it, review it. You can comment on it at YouTube and Spotify. And you can join the Patreon for as little as $3 a month to help me pay fearless editor Jen Jacobs and follow us for more. Your Apple reviews will be read by none other than my dad. Valkyrie's 1980 says,
This is one of the most refreshing health podcasts around. Jessica Wilson has the educational background and expertise to talk on these topics, yet isn't afraid to challenge her field. Highly recommended.
All right. Last Tuesday, September 9th, the MAHA Commission gave us our Make Our Children Healthy Again strategy report. Today, I'll share a few things that stuck out to me, and I also wanted to know what farmer Trampus Harmon and public health dietitians Meghan, Cichy, and Selena Salfen had to say, so they came back to the show. As we saw last time, the report isn't all bad. The good parts for me came in the deregulation section and were truly only 3 sentences. First, eliminate zoning restrictions that prevent mobile grocery units from serving food deserts. Second, fast-track permits for grocery stores in underserved areas. Third, work with grocers on sustainable incentive programs that provide fresh, frozen, canned, or dried fruits and vegetables. 3 bullet points. That's it. And that brevity and lacking details was a theme throughout. Before we get to the rest of the report, a quick CGM outcome. For those who listened to the last episode, you heard that I gave my last 10-day Dexcom to a friend. He's my most tech-connected friend. He's worked at multiple startups and for the company who actually created the tech for Dexcom 7. He also drinks 4 cocktails in the afternoon, and I worry about him. I was hoping the CGM would provide feedback that could help him examine his patterns, and surprisingly it did, but not in the way I expected. His main meals were breakfast and dinner, and then he keeps snacking after dinner until bedtime. He didn't like the way the snacking looked on the CGM graph, so he decided to add in a lunch to prevent that snacking. And it turns out that on day 8, after eating a proper breakfast and a proper lunch, he was too full for cocktails in the evening, so he just didn't drink them. So that was day 8 of 10 with the CGM. So even if he saw greater mitochondrial fitness in 10 days, then how long does that last? Which brings me back to wondering who all this connected tech is for. This MAHA strategy report is incredibly invested in that connected tech. It says that they're going to develop a real-world data platform in which the NIH will link multiple data sets, such as claims information, electronic health records, and wearables data, into a single integrated data set for researchers studying the causes of and developing treatments for the chronic disease crisis. The fact that Meghan, Selena, and I needed to sign over access to our entire microbiome and DNA results to Levels in order to use their app, and then the requirement for me to sign over all my biometric data plus my firstborn child to Dexcom in order for just Levels to give me their basic experience shows that this world is already here. And again, these companies are going to be paid for our data, lining the pockets of tech investors who are masquerading as people invested in our metabolic health. I'll think Mark and his lab results. Cichy and Kelly Means, TrueMed, and Levels, and of course Lustig, who's connected with Levels and a bunch of other tech investments. The MAHA strategy report also stayed consistent with the narrative that we need to keep up the birth rate and fertility in this country. It does mention both men and women this time, not just moms, though also included are adolescents. Quote, HHS will launch a MAHA education campaign to improve health and fertility. This will influence adolescent health through early adoption of lifestyles that help avoid the development of root cause issues that impact adult fertility, end quote. And as someone who had primarily fear and abstinence-based sex ed in the 90s, I'm curious how this is going to shift to don't wear polyester underwear, don't eat sugar, only eat organic food, and participate in the presidential fitness test in order to have all the babies you want. Will they stick to talking about sex in a hetero marriage, or will the message be have all the babies possible? We remove funding for abortion and birth control so that you can pop them out and keep popping them out. The fertility section is the only portion of the document that mentions infant health. There's no mention of infant mortality in the entire document. And then third, at the press conference, RFK and the rest of his panel said they talked to hundreds of farmers before putting together this report. So I wanted to talk to beef farmer Trampus Harmon for his thoughts. He also discussed the food deregulation section, specifically the points that want to remove restrictions on whole milk sales in schools, allowing districts to offer full-fat dairy options alongside reduced fat alternatives, to eliminate mandatory reduced fat requirements in federal nutrition programs to allow consumer choice, and remove barriers preventing small dairy operations from processing and selling their own milk products locally. He also talked about the bullets under the EPA process improvement section, including meat processing and manure removal. We also get into a paragraph on precision agriculture. I got to talk to Trampus from Dolores Park in San Francisco on my lunch break a week ago. He was at his house, and the internet was a bit wonky, but Jen did a great job with the editing.
Initial feelings to the MAHA policy document.
It wasn't as bad as I thought it would be.
Nice.
It sort of felt like, I'm not going to go with nice, it sort of felt empty. There wasn't a lot of measurable standards. Hey, we're going to do this in order to, we're going to increase over the next 4 years 33%. There wasn't anything measurable. It's really easy to say, it's really easy to say we're going to decrease regulation. It's like
there were no SMART goals. The children would know that these are not SMART, measurable, achievable, time limited, or something else. Maybe that's it. Anyhow.
Yeah.
Empty. Yeah.
Yeah. It just seemed like empty promises. Yeah, exactly.
Were there things that were highlights for you?
The removal of dyes in foods.
Okay.
I know that there is some research that has linked neurological conditions to food dyes in foods. It doesn't need to be there, in my opinion. And so it's like, hey, we're going to remove dyes. Okay, yeah, that makes sense to me. Replacing corn syrup with cane sugar makes zero sense to me. Like you're replacing sugar with sugar, and like that. That didn't really seem to make much sense to me.
Okay.
I did like they talked about drone spraying. They talked about precision agriculture.
Farming.
Again, there was nothing measurable in there, but as a farmer and rancher and having some background in this, that is the future of spraying of agriculture, is more precision technology. I mean, we're using, there are not us personally, but there are farms, larger farms that are using lasers and to target weeds. Like they have a giant.
All right.
Yeah, so they have a giant combine that basically runs across the field, and weeds stick up, and it shoots them with a laser and kills them.
That's super cool.
Yeah, like we have. They are able to take soil samples, and then they do precision fertilization. So fertilizing. So so you're out there with your fertilizer spreader. It has a GPS tracker. As it drives across the field, it drops more fertilizer in an area that needs more fertilizer as opposed to another area that needs less. Same thing with these drones. We're starting to use drones and drone technology to spread I know that this is a horrible thing that everybody's so upset, those kind of products out in the field, but it's more precision as opposed to, you're out there just basically using a fire hose to just get all of it. Now it's,
Yes.
hey, we are getting it in the areas which need it. And so they mention it. And again, it was not a measurable, achievable
Right.
goal, but
Yeah.
I do think that that is a good thing.
Okay. So we're going there. Not unrealistic. That part makes sense. I love that for us, as opposed to some of the food stuff that was wild, but good. Anything that stuck out as wildly ridiculous?
The removing the whole milk restriction
Okay.
in schools, I don't see why. Like, the kids are drinking the milk. Like,
Okay.
so why are
fix
we
something?
worried? Like,
Okay. Got it.
that just really stands out to me as why,
Yeah.
What's the thought process behind this? Like, you made a decision. Why did you make that decision?
Yeah, that's not in there either.
Yeah.
Yeah. Okay. Well, the saturated fats are good for us. Didn't you get that memo? You didn't get that.
Yeah.
I've explicitly not actually heard that one for sure. I may have heard from our friend Paul that it's not that bad for us, but nobody was like, please give us more. We need it.
Yeah. It's just, that was not great. The wastewater on low volume meat processing.
Yes.
I don't know what they're going to remove the restrictions on that.
Mm-hmm.
Will that benefit me? No. My current meat processor is a low volume meat processor. They fall under these restrictions. They have wastewater restrictions,
Okay.
but they're already meeting the requirements. So now they're just going to remove those restrictions and they can just pump the water. I mean, there's not much water used. There is wastewater when they clean. Like, I don't know what their end goal is on that either. Making it easier for someone to start up a new meat processing facility.
Okay.
With less restrictions. So we just pump the water into the creek. Like, I don't, like, again, it's not measurable, and I don't know what their goal is on this.
Okay, say it again. What would they be pumping it into?
Creek.
Excellent. Thank you. The people really believe that you're a farmer for that one.
Sorry, is it creek? Is that?
No, it's not for you at all, nor my spouse, nor other people. It just gives you farmer cred. That's what it is. Oh, what do you think about making it easier in theory to get small dairy products, milks into schools? Has it been hard? I don't know.
So I don't understand their logic behind this, because they're saying, hey, we're going to make this easier to get small farms, small dairy products into schools. And they removed $1 billion worth of funding for food banks and schools to buy from local farms. Like, are they just removing restrictions but not providing funding? So now if I'm a school and I'm trying to find the cheapest person, is the cheapest person always the best person for, providing food for my kids?
Yeah.
Or do I want somebody that is passing some regulations and using that money back into cleaning the products and cleaning the equipment, that kind of stuff? I mean,
you want food safety? Is that what you're saying?
Yeah.
Oh, okay.
So as opposed, I mean, I can cut a cow up with a hatchet in the backyard, and it's going to be pretty cheap, but that's probably not the product you want to eat.
You're not going to sell that one at the market?
No. Okay. I like the facility. One of the things, I go to a facility down in Wairika for meat processing. It's a USDA facility. When I sell you a pound of ground beef, because they're one of the cleanest facilities I've ever been to. All of their equipment is updated. I know this sounds weird, but it's, an expression. I feel like you eat off the floor. Like, it's just so spotless. Like, the walls are spotless. The floors are spotless. Everybody's walking around in, hair nets and beard nets and lab coats, and their lab coats are pristine. Like, everything that they do is professional to me.
Yeah, I'm with you.
Yeah, like, again, but I pay a price for that. And if we're removing that funding from schools, going back to what I was saying, like we remove that funding from schools, now the schools are trying to find the cheapest person. Now they may not go to that facility. They may have to go to a different facility.
Got it. So the idea that there are not chemicals in our organic food, what do you think about that?
All food is made of chemicals.
Okay, we'll start there.
Even the water we drink is H2O. That's a chemical.
Yes.
There are chemicals used in organic farming. Retinone is used in fisheries to eradicate invasive fish. Like, it's still considered an organic chemical. Burnout is used in organic farming. There's copper sulfate is used in organic farming.
Yeah.
It's all the dose makes the poison. I mean, you're out here, Roundup is not safe. Roundup at a certain point is not safe.
Yeah.
Copper sulfate at a certain point is not safe. To say that we're not using chemicals when copper sulfate is literally the name of, copper and sulfate or sulfur.
Sure.
That's a chemical. Like, I don't know the people that say this, did they not pass basic chemistry? That was like high school chemistry, copper sulfate.
I mean, and if you go to the hardware store, there's the organic fertilizer and not organic fertilizer. It's not like the organic one I should be drinking. Like that's what it sounds like. I'm not doing that.
And the MAHA report talked about removing some of the restrictions to become organic and making it easier and faster to become organic. And so
that doesn't sound that good to me.
It doesn't. Like, what does that mean? And we're removing the plastic requirement is it PFAS? Is that what
Yeah.
Okay. Yeah. So we're removing that from wastewater or from drinking water. Like, are we also removing that from, what are we removing from the organic requirement? And so I worry about removing too much regulation.
Yeah.
I worry about moving too far into regulation and removing too much regulation. At a certain point, you can't do business. But at a certain point, some people should not do business,
Right.
So we have history in the United States of poisoning our own rivers, when we killed all the bald eagles. We were using DDT.
Yeah.
And it killed the fish, and then it killed the bald eagles. My concern is we have a history of doing too little regulation. And I do understand people's concern about over-regulation, but at the same time, you have to look at what happens with under-regulation.
Yeah. Yes, the argument is always like other countries do a better job of regulating X, Y, and Z thing. And I'm like, so they have regulations? Is that what you're saying? Okay.
We go back to the food dyes. European Union banned food dye number 40. It's like,
sure.
Did they just name it something different and still allow it over there? And, it's
fair. Yeah, you've watched the John Oliver clip.
Yeah, last week tonight when he went over the MAHA report, one of the things that was really hilarious to me was he was talking about Cichy Means, who is a MD. She's being looked at, from my understanding, as the next Surgeon General.
Yes.
She was on a podcast and she drank a liver smoothie. And that really love the John Oliver, Jon Stewart, Daily Show, Last Week Tonight, like that kind of humor with my news.
Yes.
It really captures my attention and, draws me in and makes me think at the same time. And so, she was on this podcast and she's drinking this liver smoothie and she's like, "Oh, this is delicious." And she started gagging. Like, it's like, oh, why are you lying? Be like, no, this isn't for me. Like, it's not that big a deal to tell people once in a while. I don't like guacamole. It's a fairly thing to say to people. Like, oh, thanks, I appreciate
this mushy thing, not into it.
Yeah. I'm on a farm and the only thing that's green and running around here is cow shit. So I'm not big on guacamole. So,
okay.
I'm not real sold on people that have such a vested interest in their own products.
Yes.
Like she has a line of smoothies. She has a line of basically a line of bullshit that she's selling. She's going to Surgeon General and she's going to totally divest herself from all that stuff. I'm sure because that's what's totally going on right now with,
Yeah.
I mean, even RFK Jr. selling the MAHA hats at the beginning of one of his speeches, like, hey, buy my hat. And it's like, I don't know what, his pay is, but I'm imagining that it is
enough.
Not so low that he has to hawk hats.
Yes. First thing that you can do to support my campaign, buy my hat.
Yeah. Like it blows my mind how far we are because I did 20 years in the military. And one of the things we taught in the military is you cannot endorse something while you're in uniform. Sergeant Harmon could not go down to a used car dealership and buy a car and be recorded saying, hey, I really love car dealership.
Okay.
As when I took uniform off, I could totally do that.
Okay.
But as a representative of the military, I couldn't do that. But now we have politicians who are selling hats, Rolexes, Bibles, all this other stuff. And I have a hard time with that. Like, I really do. I feel like that is unprofessional. And yeah.
Is it anti-American?
I don't know if it's anti-American. It's just anti-my views because it seems like one of the most American things you probably could do, but still, it just seems wrong, right? Yeah. I mean,
yes.
Yeah.
You have a moral compass that doesn't always align with the values of this country.
Yeah, and that's fine. Like at times I can have a political disagreement with someone and still enjoy who they are as a person. But at a certain point, it just becomes, are they a person or are they just living a political ideology? And I don't like that. And so, yeah.
Okay. Anything else in your note?
So they did talk about ensuring flexibility for manure handling on small farms. I want to know what their definition of a small farm is.
Okay.
In Oregon, again, I think we have an overregulation in Oregon. They went to, if you have 1 or 2 cows on concrete, you need to have this wastewater management set up. I think that is overregulation. But at the same time, I had a dairy, and so I have 200 cows at one time on concrete, and we had a wastewater management facility set up. So we had a lagoon. We separated solids from liquids. We couldn't pump liquids during certain seasons and all that. This is all for protection of the watersheds and et cetera, et cetera. Okay. That is what should happen. Where is their definition of small farms? Because again, I didn't find anything in the MAHA report that was measurable. I spend a lot of time looking at numbers and thinking about numbers, and I don't see any numbers in that.
Okay. So, thank you for your time.
You're
Come
very
back
welcome.
sometime. Come back.
Thanks to Trampus for joining us back on the show. I also got to ask him about the beef market this year and whether it has been influenced at all by MAHA. I put that recording update along with the influencer-inspired product he made over on the Patreon for members. In addition to my chat with Trampus, Meghan and Selena submitted 3 things that stood out for them. We'll start with Meghan.
All right. I am back recording a voice note with my thoughts on the MAHA strategy report. I'm excited to get this out so we can sort of share our thoughts with folks who are listening. But some of the things that stood out to me, I watched the strategy report press conference that came out just before they released the full strategy report. And I mean, we saw in there another mention of them planning to fix the food pyramid, which I just think is so funny that, we've talked about before. That hasn't existed for decades. And there's actually no mention of it in the report that I saw. But they are planning to, revamp the dietary guidelines for Americans, which is something that is done on a regular basis anyways, but they're wanting to revamp it and they're wanting to make it really simple and accessible and all those things, which is great, makes sense. But I keep wondering what the plan is for changing compliance, right? So we already know that Americans don't meet the existing dietary guidelines. And so I'm curious to hear their plan on how they might be intending to implement those guidelines and see changes there with compliance or adherence to their new dietary guidelines. Looking forward to that. Another thing that came up during the press conference or the press event is Lisa Desjardins from PBS NewsHour asked a question about children's mental health and suicides as it relates to firearms, and asked if there had been any discussion on looking into firearms and the health of our children, to which RFK responded that it's complex and what they're most concerned about is violence. So he said that they're focusing on research on the dependence on or overprescription of psychiatric drugs on video games and social media as confounders, but won't be looking into firearms. He talked a lot about the violence that sort of erupted in the 1990s when we started seeing sort of these school shootings, these mass shootings. And so he's really thinking that that's a result of this overprescription of psychiatric drugs, video games, and social media. So that checks that sort of decision to not look into firearms, checks with what Jessica Nurek had wrote in her September 12th Substack, addressing gun deaths. And she shared in there that the 1990s was also the time when the CDC started looking at gun violence as a public health issue. But now we're starting to see the House Majority's fiscal year 2026 labor HHS appropriations report. It's eliminating every program that's related to gun violence prevention from the CDC's budget. So it's zeroing out the CDC line for firearm injury and mortality prevention research. So it's cutting from $12.5 million to zero. It's eliminating the injury control research centers that often houses firearm injury teams from $11 million to $0. And it's cutting out the National Violent Death Reporting System, which, as Jessica says, is the backbone data system that helps states to track shootings and suicides, cutting that from 24.5 million down to zero. So this strategy report has a really strong focus on increasing research and making research gold standard and transparent, but firearms and firearm injury prevention is not an area of interest in this report or apparently in this administration, which is really frustrating, especially from a public health and a parent's perspective. The report also talks about ensuring that the programs at the Health Resources and Services Administration, or HRSA, is effective at providing access to pediatric mental health professionals, but it doesn't talk about how. And that's something that I saw throughout this report, that the policies are still super general. There's very little specifics or implementation details, with one exception where their report was talking about areas of deregulation. There was significantly more details and more specific ways that they would be making these changes. But throughout the report, lots of surface plans. And so I anticipate additional reports or implementation plans that might come out so we can really see what this means. But as I was listening to and reading up on what folks were saying about the strategy report, there really seems to be a split between people who feel that the strategy document is really nothing, and that while it says some good things, it also includes problematic things and is really not going to push anything forward. There's also others who see this strategy document as a win and monumental with a really clear pathway forward. So there's some inconsistencies there for sure. I also noticed that it seems to be that Callie Means and RFK Jr. are realizing or starting to realize that the MAHA wellness influencer talking points are not so easily transferable into policy change because of how deeply interconnected these issues are with things like industry, jobs, and on and on. And this can't just be about what a few individuals want. Policymaking is significantly more complex than that. So one of the other things that stood out to me in the report, and I think we're hearing a lot about and RFK talk about often, is the inclusion of nutrition training in medical school, how doctors aren't trained on this, or they have very little training, or it's not a requirement. And really, I'll just refer to Marion Nestle's commentary on that. But one of the things about that whole conversation that's standing out to me is The focus is on medical school to the exclusion of all other providers that provide medical care and primary care. There's no mention of curriculum for nurse practitioners or physician's assistant, all of which who provide primary care services. And there's also no mention of dietitians or increasing patients' access to them. And we know that dietitians spend significant amount of time training and learning about nutrition itself, but also how to work with patients and how to integrate the information in a way that aligns with the patient's needs and their circumstances and their resources to support behavior change, all those things. Another piece that stood out to me in the water, fluoride, and PFAS paragraph was there was mention of taking action on unapproved products, often marketed as supplements, but there was no mention of a move to regulating and reviewing supplements for safety and effectiveness more generally. And so that continues to be something I am looking out for as these MAHA and wellness influencers continue to profit off of their supplements, but there's no attempt to sort of regulate them to control for safety, effectiveness, etc., to ensure that the population is getting what they think they're getting and able to have some sort of reference and recourse for how those supplements might impact their well-being. Another thing that stood out to me is the reports call out for enhancing prior authorizations for Medicaid managed care organizations. It seems like a really strange contrast when we're hearing a lot about removing the administrative burden for providers so they can spend more time with patients. And this would actually decrease a provider's ability to spend more time with their patients, increase their administrative load. And I think maybe that's the point here, because prior authorizations are incredibly time consuming, and it makes it harder for providers to use their medical judgment to get their patients the treatment they need. And in this case, it is specifically about making it harder for kids, and I'm assuming adults as well, with ADHD to be able to access their medications. They're happy to increase the administrative burden in this instance. So I'm curious to see if we'll see that change in other areas of practice with addressing prior authorizations. But that was another one that stood out to me. And again, I think overarching, this report doesn't say a lot about the how. And I look forward to seeing what their actual plans are to do all of these things and not just what their hopes are. This feels like hopes and dreams, and I don't see the implementation plan. So I'm ready for that next.
Thanks to Meghan, and then we'll tee up Selena.
Hi, y'all. This is Selena, and I am back to record a voice memo with my thoughts on the latest MAHA strategy report. I think the MAHA strategy report was quite ambitious with the amount of things they wanted to address, but not very ambitious with how they would actually do that. So once again, it was just really lacking the details that I would like to see on how they're going to make things work and if they're feasible. So there are 3 things that stood out to me. I noticed they really watered down their plan to address food and pharmaceutical advertising. The MAHA leadership that made it to the White House has always had banning TV pharmaceutical ads as an important part of their platform. And RFK Jr.'s closest advisor, Callie Means, currently lists on his website banning TV pharma ads as one of 5, quote, simple policies to transform American health. And he says the U.S. and New Zealand are the only countries in the world that allow pharma ads. And he said many times the president could instruct the FDA to ban pharma ads tomorrow. So it seems that maybe that policy was not quite so simple after all. And, otherwise there would be an executive order to do that. So in this report, they now have the flimsier goal to focus on increased oversight and enforcement for violations of direct-to-consumer prescription drug advertising laws. And they go on to say egregious violations demonstrating harm from current practices will be prioritized, including social media influencers and direct-to-consumer telehealth companies. So I'd say that's a far step from banning pharma ads and can be applied really selectively to their political enemies. And they also really backed off of limiting food marketing to children. They initially said they would ban advertising of ultra-processed foods or quote-unquote unhealthy foods to children. And the report now says they will, quote, explore the development of potential industry guidelines to limit the direct marketing of certain unhealthy foods to children. So to me, this means nothing. This is a nothing burger with no teeth. The words explore and potential are really light and just, they're not going to bring this home. And this also makes me think back to the Tucker Carlson podcast that got the MAGA crowd really interested in Callie and Casey Means. And on that episode, I remember Callie very confidently saying that Michelle Obama was right in the first year talking about food, but then she was directly influenced by the food companies. So I'm really wondering what's happening with their policies. Callie and Bobby, are you being influenced by big food and big pharma lobbyists, or did you just water them down on your own? So it doesn't surprise me that banning pharma ads and food marketing to kids is just really too much regulation for this administration. I know MAHA talks a big game, but is not impervious to big food and big pharma lobbyists. I was also struck by, but definitely not surprised by, the hypocrisy in addressing conflicts of interest in research and policy. So the report has a section on requiring disclosure of financial conflicts of interest for anyone on advisory committees or doing government-funded research. And they say they'll have people with conflicting interests recuse themselves from, quote, particular matters that will have a direct and predictable financial effect on the financial interest of the individual involved, unquote. So if that's how they feel, they may want to start with their closest staff and advisors. Again, with Callie Means, he's a special government employee who is highly influential on MAHA policy, but he does not have to disclose his financial conflicts of interest, such as his company TrueMed, that's very much poised to benefit from some MAHA policies. He also posted that he sold his 401k and bought stock in clinical stage biopharmaceutical companies that really focus on psychedelic-based therapies, something else that MAHA has been very excited about. And then Casey Means is an investor in Mark Hyman's company, Function Health, and TrueMed, and of course Levels, the metabolic health company poised to make money from RFK Jr.'s push for wearables, specifically CGMs, or continuous glucose monitors. They say they want to, quote, protect public health from corporate influence, but what I'm hearing and seeing is that they are tired of conflicts of interest with big food and pharma and would like to trade them in for conflicts of interest with big supplement and big biotech. And the third thing that stuck out to me was their continued misunderstanding of autism and ADHD. So they're really continuing the idea that they're going to stop people from being autistic or from having ADHD or having mental health challenges at all. And there is definitely no room whatsoever for disability or neurodivergence acceptance in MAHA. And although it's not explicitly said in the report, most of the people that they take health advice from, such as Dr. Chris Palmer, think mental health and neurodifferences can be, quote unquote, cured through environmental or diet interventions in pregnancy or in childhood. And the strategy report says, quote, HHS will evaluate the therapeutic harms and benefits of current diagnostic thresholds, over-prescription trends, and evidence-based solutions that can be scaled up to improve mental health, including through school-based interventions, diet, and foster care services. So I've been really concerned by that last one. What do they mean by foster care services? Are they talking about taking kids away from parents and caregivers because they don't like how they're addressing mental health or neurodevelopmental differences? And I don't want us to forget that RFK said he wanted to create wellness farms for people on opioids, SSRIs, and stimulants where they can go be, quote unquote, reparented and grow their own organic food, because a lot of behavioral issues are related to food, he says. So as usual with MAHA, some of what they propose in the report sounds okay on the surface, but what will really matter is how it's implemented and who is consulted in that implementation. And of course, they keep firing or forcing out the people with experience, and then they get most of their ideas from people with half-baked credentials and or no life experience or policy experience with things like food insecurity. So for them, this is still very much public health amateur hour at HHS, and there's a lot of space between what they consider easy fixes and actual on-the-ground implementation. And finally, I'm really looking forward to hearing more about the MAHA boxes that they're planning for SNAP participants. And of course, I'm hoping for the best, but would be surprised if they understand how to send people food that they want to eat or that's culturally relevant and that they know how to prepare. And right now, of course, I'm envisioning a box of the Food Babes protein powder and Paul Saladino's meat sticks and maybe Cichy Means basil seeds. So while I enjoy laughing at this mental image, I would much prefer to see meaningful changes in food access.
And with that, I gotta say, it's been a MAHA of a journey for all of us friends, and we've only scratched the surface. There's more to the report, and I'll come back in the future as or if things start to roll out, especially those supplement regulations. As far as what we can expect on strategy implementation timing, RFK said, unspecifically, quote, very quickly. And then that's it for Making It Awkward today, friends. I'm Jessica Wilson, hoping that you know where your manure should go so that things don't get awkward. You can support me by buying my book. It's always been ours. You can follow me on Instagram, jessicawilson.msrd. You can support the show by rating, reviewing, subscribing, and joining the Patreon. The show is edited by Jen Jacobs, who knows what a SMART goal is. And it's supported by the legacy of Sacramento Health Board Services.
Hold on. Did I not record that? Oh no, stop recording. Oh my God. Stop recording.